Good afternoon. My name is J.Gomez, and I am your caseworker assigned to address your concerns about Brody. First of all, I understand Brody is 15 years old and is being raised by his single mother. She is concerned that his inappropriate behavior has exceeded the normal teenage disobedience. While Brody has demonstrated an above-average intellectual ability on his school assessments, his tendency to argue with his teachers and other school staff has negatively influenced his grades. It is a positive sign that there has been no history of drug use, and most of his negative behavior has been limited to his home or at school. With that being said, I would like to help identify what disorder he may have, correlate his symptoms to this disorder, and suggest the appropriate treatments to improve or minimize the effects of this disorder. First of all, I would like to introduce you to a childhood disorder known as an externalizing disorder. Obviously, this disorder is defined by an outward behavior of aggressiveness, non-compliance, and impulsiveness. While Brody's symptoms may be a sign of conduct order, they are not as severe. In Brody's case, I believe he has exhibited the symptoms of oppositional defiant disorder, or ODD. As mentioned earlier, he loses his temper, argues with adults and or other authoritative figures, and refuses to comply with their requests. But most importantly, he has not become aggressive or violent. While this behavior is mostly common in males between the ages of 13 to 17, we should address these issues before it develops into something more serious. To completely understand the etiology of this disorder, I would request some information on his father and history of his mother to confirm the presence of any genetic factors. Although Brody's tests are above normal on school assessments, I would also like to test him for any cognitive issues with a different type of assessment. In addition, I would like to know about any trauma Brody has experienced in his childhood to determine if any psychological factors exist. Lastly, I would like to determine if his behavior was influenced by his peers in any way. In any event, I'd like to meet with Brody and his mother to get to know them better assess the situation, offer parental advice, and provide feedback to his negative behavior. In addition, I would recommend parent management training, or PMT, to teach a mother to use positive reinforcement for positive behavior and removing privilege for negative behavior. If this treatment was not sufficient, then I would supplement it with a multisystemic treatment, also known as MST, which would include therapy services for Brody, his mother, his peers, the school, and the community. Programs such as Fast Track help adolescents with their behavior, their social skills, and their academic skills. The most promising news is that research has shown that the sooner we get an understanding of the situation and provide treatment, the appropriate treatment, the sooner we can address Brody's behavior issues. With that being said, I want to assure that we will utilize the most effective treatment to improve or at least minimize the effects of oppositional defiant disorder. Thank you for coming to me for assistance in this matter, and I look forward to meeting with Brody and his mother. Have a nice day.